Our land acknowledgement.
We respectfully acknowledge that the County of Haliburton is located on the Treaty 20 Mississauga territory and in the traditional territory of Mississauga and Chippewa Nations, collectively known as the Williams Treaty First Nations. We acknowledge the shared presence of the Indigenous nations throughout the area and recognize its original inhabitants as the stewards of its lands and waters since time immemorial.
Any disclosure of pecuniary interests? Seeing none. Agenda.
That the number 12, 2025 Haliburton County Council agenda be approved.
If someone move, Councillor Ferry, second by Councillor Ryle. All in favor? It's carried. Thank you. This morning, Council, we have Lakelands Public Health budget presentation. We have Dr. Piggott, Medical Officer Health. Welcome. And Chief Executive Officer, Deputy Mayor Ron Black, and Board Chair, and Haley Atter, Director of Community Health. Welcome.
Good morning. Thanks. I think Chair Black will start.
Yeah, thank you, through Warden. Appreciate the opportunity to come forward today. I first want to acknowledge Councillor Ryle's contribution to Lakelands Public Health and the Legacy Public Health units through the merger process. And Councillor Ryle and myself have somewhat tag teamed over the last 10 months to bring things forward. It's been a challenging time, and I've greatly appreciated Councillor Ryle's support through the whole process. So I just want to take a couple of minutes to talk about sort of the history of what's happened with the Legacy HKPR and Legacy Peterborough Public Health units. It's been 50 years since the first time this was attempted in 1975, 3 different attempts to merge the 2 health units. HKPR circled almost Peterborough County and City, so it was a logical merger. One of the things that was brought to mind through the process was in 2018, the province announced that public health would go through a modernization process that would see 36 units merged into 10 and would take a 10% budget cut. So that was 2018. COVID kind of got in the way of that, the legislation, and it stopped. But it would have likely seen both of those, our health units, merged in with Durham Region. And possibly Scarborough, because that was the old Lynn boundaries that were there at the time. In 2023, the province of Ontario announced voluntary merger opportunity for public health with a 3-year funding support to create health units of about 500,000 people. So our new health unit's about 340,000. So we're still under that, but really, the thoughts around this was, let's determine our own destiny and merge voluntarily with financial support before the province maybe comes back with that proposal to force the amalgamations. And I think most of you are probably aware what's happening with our conservation authorities. The announcement last couple of weeks going from 36 to 7. In Ontario. I think they dusted off the old health, the public health documents to make that happen. COVID-19 really highlighted issues around preparation and capacity for the 2 smaller health units. Both were challenged. Most staff in both health units were dedicated to COVID-19. A lot of other things had to sit on the back burner while COVID was going on. Both legacy units had outdated systems, and it was difficult to complete the mandatory work that the Ontario Public Health Standards requires us to do. So that was another good reason for us to look at merging and improving the services. Over the last 10 years, public health in Ontario has only received 6% increase in our base funding over the last 10 years, 6% in 10 years in base funding. Inflation was 28% over that period of time. So you can understand what's happened every year. It's caused really a difficult situation with respect to budgets, and trying to find municipalities with a reasonable rate increase usually meant some layoffs almost every year over the last 10 years. So without the merger, really, we felt that there would be significant program reductions in a time when both units were already struggling to maintain minimum public health standards. or apply double-digit municipal funder increases. The merger funds are going to help support the modernization of public health, reduce long-term operational and capital municipal financial commitments, including the per capita harmonization between municipal funders, and provide for program and productivity improvements that can be reinvested into our public health system. So from there, I'll pass it on to Dr. Piggott.
Thanks so much, Chair Black. Thank you all for having me. It's a real pleasure to be here this morning, though maybe should have spent the night at the cottage down the road instead with the weather out there on the road this morning. It was a bit of a drive up, but excited for some of the trails and winter activities to start, maybe sooner than we would have thought. I just have some slides to work through, and I think Chair Black's covered a good chunk of it, and also want to express my appreciation for Councillor Ryle and all the advice, mentorship, and contributions this year as we've been going through a pretty hard year. Mergers are hard, but as Chair Black had said too, this is really a good thing for our communities. This is about creating a stronger, larger, more capable health unit together and having more capacity to do the important work that we do. It also, I've been saying, is a bit of a Goldilocks zone. Both health units before were a little bit too small, and the merger that was proposed back in 2018, I think would have been a little bit too big. But I think what we've been able to create with Lakelands Public Health, we have our new name and logo, is just right. And we'll be able to continue the local relationships throughout the whole region that are so important to the work that we do. So if you can go into the next slide, this just has a brief outline. And then timing wise, there's about a minute and a half video. Warden, would you prefer that I defer that and just get into the presentation so that we shorten the time, or it's okay? We're okay for about 15 minutes total. It's okay. All right. So we'll play this video, which is just a bit of a brand launch video for Lakelands Public Health. Thank you. So just a short video. We're really excited about the new brand, and it's more than a name and a logo. The journey's really been a conversation both with our staff and our team and with communities that we serve to bring people together under this new banner. If you go into the next slide, it just describes a little bit about the logo, but if you can see, there's actually 8 parts to the logo, 3 water parts in the bottom, 3 land parts above, a sun and either the reflection of the sun in the water, or if you prefer a moon we've talked about as well. And those 8 parts represent the eight communities that we serve. The circular form is reflective of the continuous nature of public health, and the circle in the center really represents the individual at the heart of the community and care of the work that we do in public health. So we're proud of it. We thought it was important to find something that would work for the whole region, and lots of conversations with folks up in Haliburton as well, because some of the language and names sometimes used in other parts of the geography don't resonate here, but this worked everywhere, and hopefully you'll agree. On to the next slide. We have a new website, lakelandsph.ca, new toll-free phone number that folks can reach. The previous numbers will still be for quite a long time redirected. New social media channels as well. And if you go on to the next slide, this just shows the actual geography. So again, like Chair Black said, 340,000 people across the 8 geographies. Onto the next slide. We also were very reflective on Indigenous perspectives in the brand, and there was a component of Indigenous engagement that was really important to the whole process. And representation of Mino Bimadzawin, or the good life, is really represented at the circle and wholeness of the whole image. On to the next slide. Pleasure to also talk about budget-related perspectives. And then afterwards, I'm going to talk a little bit about the progress we've made in the merger so far. And Hallie's going to speak a little bit about health equity and fairness through the community and how we can partner together with the municipalities, with our partners in improving health for the communities we serve. So on to the next slide. The 2026 budget that we've had approved by the Board of Health sees an increase of 3.7% in expenditures, and the total contribution is $33.70 per capita, which is a 5% increase to the local funder contribution for the County of Haliburton. If we go on to the next slide, this will show a bit of that. So even though our budget's only going up 3.7%, which is represented by the second green bar, the drivers of that are represented in the first green bar. In the third green bar, you see if 3.7% was shared equally with a 75-25 share, which is what the province has touted for public health, the increase on local funders would be 291,000. But because we've been told by the province the increase is going to be limited to 1%, the increase on local funders is just over $1 million. And the way that that has been divided is with a 5% increase to all local funders, but then harmonization, which if you go to the next slide, there was a discrepancy in about $10 per capita between legacy Haliburton Kawartha Pine Ridge funders, including yourselves, being larger than the legacy Peterborough Public Health funders. And through a couple of years of work and many, many conversations and discussions on finding agreeable grounds for a solution, with huge thanks to Cecil and Ron, who've really brokered important conversations, we've found a strategy that everyone was agreeable to, which is to harmonize over a 5-year period. That harmonization's front-loaded, which allows the funders to take advantage of some of the merger funding we're dealing with until 2027. And you'll see these are just hypotheticals, each year's budget. So we put 5%, but that's just simply hypothetical. Each year's budget will be determined by the board on an annual basis. By the end of 5 years, we'll be fully harmonized. If you can go on to the next slide. One of the things that is important to note is that we were certainly in financial challenge, both previous health units before the merger, and that's driven by the sub-inflationary increases we've had for the better part of 1 to 2 decades in public health. COVID really highlighted the needs and capacity, and we did get very generous time-limited funding, which is now over from the province to help increase capacity through COVID. But we had outdated systems and tools. We struggled to complete our mandated work within the budget that we did have. On to the next slide. We've made great progress so far this year. So the merger officially happened January 1st, 2025. On to the next slide. The board has come together. We have a new board with representation as seen in the picture from all the communities that we serve. On to the next slide. The merger progress so far has found efficiencies. We've been able to continue all of our programs and services. We are making investments to improve systems, tools, and facilities. We've been able to outright purchase a building, decreasing the costs of servicing that interest and principal payments to a mortgage. We've modernized our IT systems. We're in the process of. So lots of investments that will result in long-term improvements and also efficiencies. We've seen the skills of the board assessed and grow. We're meeting all of our provincial milestones through the progress. And all of the programs have started to come together in harmonization to say, how do we do it in this health unit? How do we do it in that health unit? Should we do it one way or the other? Or perhaps there's a new way forward that's even stronger and better than before? Because again, this truly is about strengthening the public health services for the communities we deliver. On to our next slide. I'm now going to turn it over to Hallie, who's going to speak a bit about a story and the context of some of the work that we do to address health fairness in the communities we serve.
Thank you. Good morning, and thank you for having me. As Thomas said, in the next couple of slides, I'm going to share a story that will help us understand how unfair but avoidable differences can impact the health of future communities. We know that health is not only determined by our biology, but also in the places where we live, we grow, we work, we play. And things like political, legal, and economic determinants, as well as social norms and institutional processes, shape the distribution of power and resources available to people. And this has substantial impacts on a resident's health and future health potential. Next slide, please. So let me start my story. I'd like to introduce this Sally. Sally is pregnant, she's single, and she lives in the county of Haliburton. She receives a combined income of $1,509 a month, and 90% of that amount is used on her rent. And so, as you can imagine, there isn't a lot left over. And if we calculate how much she should be spending on nutritious food, which would be $455, as you can see, there's not enough for that. Next slide. A few months later, Sally gives birth to a little boy, and his name is Jeremy. Jeremy is born into a home that is food insecure, and because of that, he has a much higher likelihood of experiencing what we call as adverse childhood experiences, and which will shape his health and his future as a toddler, as a school-age child, as an adolescent, and as a young adult. Many children in households like the ones he's growing up can experience things like parents with mental illness, parents and caregivers who are using substances. They may be experiencing abuse or witnessing abuse or violence. And in Jeremy's case, it may be compounded by witnessing activities ranging from microaggressions to threats of personal safety through racist activities. Next slide, please. These experiences that I've just described are potentially traumatic and stressful events, and they can impact lifelong physical and mental health and well-being, educational level, and socioeconomic status later in life. For Jeremy's story, they lead to frequent absenteeism in primary school, early introduction to vaping in middle school, intimate partner violence in high school, and substance use before he graduates. And by the time he's 19, he is at risk of homelessness. Next slide. And unfortunately, his mother, Sally, has experienced this as well. And we know from research that poverty and housing insecurity and experiences of discrimination, stereotyping, and prejudice all can increase the likelihood of Sally experiencing substance use harms and assault or violence. Next slide. The downstream consequences of situations like Sally and Jeremy have real costs. And as you can see, if we just look at the impact of housing, that housing has on health alone, we see that patients experiencing homelessness typically have an increased length and cost of hospital stays, which you might notice is actually about the same amount of costs for a year of housing. Next slide, please. So how can we change this story? How can we change the outcomes for Sally and Jeremy? Well, first of all, Lakelands Public Health, as a public health agency, we can help through the delivery of programs like our Nurse Family Partnership. That's a home visiting program that supports families like Jeremy and Sally's both pre and postnatally. We can work with partners in the community to deliver interventions that will reduce the risk of adverse childhood experiences. We can champion and partner on research on things like the prevention of substance use in youth. We can advocate for policies that can provide things like basic income solutions. Next slide. However, we can be even more impactful if we work together as a community across all sectors, and that's where municipalities come in. By collectively identifying the needs of our community, by bringing together all of our strengths and areas of expertise across sectors, we can collectively determine what are appropriate interventions in our community and develop a coordinated and integrated approach that will just reduce things like substance use and chronic disease and create healthy, resilient people and communities. And we can change the trajectory of health and well-being for Sally and Jeremy and many others like him. Thomas?
Thank you so much, Sally. Next slide. We just wanted to provide that both to provide you with some concrete data from the community that you represent, but also to say this is a partnership. And I've been telling our team, we're not creating a health unit for today or tomorrow or even next year. We're creating a health unit for generations to come, to serve for generations to come. We see a lot of challenges visibly on our streets, homelessness, substance use, and I know even in this region, those issues are present and visible as well. Those issues, like the story of Sally and Jeremy, have their origins in 2 or 3 decades ago and kids growing up then. The challenges we're seeing now and the inequality is growing. It's worse. The challenges we may face in 20 or 30 years if we don't start to change that could be far worse than even what we're seeing today. If we go into the next slide, we're starting conversations around what we need to do to effectively serve your residents and work together. And this is part of a strategic planning process. And we're going to do a lot of direct community engagement. If you go on to the next slide, there's already a survey that's out there, and would appreciate if you could all share this so that residents could complete and share what their perspectives and priorities on public health are. But I also had some questions to leave you with today. If you have thoughts or if you want to meet at some point or write to me, very happy to hear what are the priorities you're hearing from a public health standpoint for your residents. How can public health more effectively serve your residents? And how can we partner more effectively together? So thank you so much for the opportunity to join you this morning. I'm looking forward to many more conversations to come. I know you've had a relationship with your health unit, with Dr. Bocking, who still is working very closely with me as we're doing the continued work of public health for the community that you serve. And really appreciate the chance to get to know you all a little bit better and work together on a go-forward basis. So thank you so much.
Thank you, Doctor. Just before I open up for questions, I'd just like to thank you. You have put a lot of thought, a lot of work, a lot of effort into this, and I certainly thank you for that. Gary.
Thank you, Warden Burton. Just prior to being turned over to council for questions, I think it's important that I recognize the work of Dr. Piggott and his staff, and through the amalgamation and the work they've done. More importantly, the outreach that we've been given into the county from the health unit, sharing the vision, sharing the strategic outlook for public health, but also being very upfront with us on the impacts of amalgamation, what it's looking like from a financial standpoint, but also from an operational piece. And it showed a real understanding of the challenges faced not only broadly across public health, but also specifically for the residents of the county of Haliburton. And also being very open with us regarding the financial plans going forward. And we do appreciate the efforts that you've done, Dr. Piggott, with respect to respecting the financial considerations in Haliburton going forward with the way the budget's been developed going forward. And lastly, to say the outreach and involvement with myself and others in the county staff on the advocacy piece, to work reaching out into the province and looking out for the long-term goal is like to say all the time is we're just not planning for Tuesday, we're planning 1,000 Tuesdays from now. So I think that's really impressive, and I'd like to thank him for those efforts.
I know it wasn't a question, Warden, but through you, if I can just say thank you to your CIO as well. Deep, committed partnership, and as a newer and younger leader, and always somebody interested in learning, great mentorship, support, and advice in navigating the challenges that we're facing. So deep, special thanks to Gary as well for that.
Questions, council comments, Councilor Rao.
Yeah, I think it's important to note that we've been working on this for about a year, and I've had the absolute pleasure of working with these two gentlemen along with the team that backs all of us up. And not to say that there weren't challenges along the way, nor was there disagreements. There was always the opportunity for compromise it was always looked in the position of how do we make things better. And at the end of the day, I think it's safe to say that of the 4 mergers that are going on in Ontario, we are showing how it should be done. We're looking at today, we're looking at yesterday, and we're more importantly looking at tomorrow. And in addition to that, I'd also like to thank our council and the Council of Peterborough, Peterborough County. Together, you guys sponsored a delegation at AMO that in itself didn't really accomplish a whole lot when it came to getting money at that particular point in time. But what it did do is open the door for us to meet again with the province in November to look at the whole program that we've been talking about right now. And I think that opportunity is something that we're going to take advantage of. And if anything, it will help us both deliver a better service going down the road and hopefully do it in a much more economical and fiscal way. So thank you very much, gentlemen and ma'am.
Other questions or comments? Councillor Carter.
Well, thank you for the presentation, and I know any merger like this is a difficult journey. I guess just a couple of comments of, I can't remember where I read it, if it was in this presentation, but your idea of reducing the expenses at the top end and making more frontline services available. I think I would applaud that and hope that you could continue on that. I think the other things, we have a shortage of virtually every provider in the healthcare space. So we can talk about nurse family partnerships and home visiting, but if there are no nurses, then that doesn't happen. So I would encourage you to stick to the things that you can really do and affect. Unfortunately, maybe some advocacy stuff has to go by the side because we need to be doing our primary role. I think the other issue of trying to keep things under control is some like climate change that has brought in new insects and new diseases that you guys need to prepare for, because if it catches us flat-footed, there's a large impact on our society. So all the best in all this, and anything that we can do to help or work with you, I'm sure we will try to do.
Other questions or comments? Councillor McCackney.
Yeah, like your presentation, lots of great information. But I'm just like probably everybody. I'm extremely concerned with the issue of the mental illness, and in our little community of Haliburton, I mean, Murray and I see it growing every day, and I could sit here and tell you umpteen stories, which I'm not going to bore you with because probably every community has the same problems. But I'd just like to know how we're going to fix this. Like I know you're talking about home nurses and all that, but I think this issue is so big that Bob's talking about climate change. This has nothing to do with climate change as far as I'm concerned. I'd like to have all the money that's been put on climate change and given to people like you and the powers to be to correct this problem, because it's devastating our communities. I mean, it's scary almost. And I've been in other little communities in the last month, and my wife goes to a certain community every month, and I always tell her, be careful when you're around. But I mean, my question is, and I'm sure you don't have an answer, is the problem is getting extremely out of control, and I don't see it being, getting to a point where we can honestly see a decrease in the number of Jeremys, and was it Sally? I forget her name, but it just seems like it's growing. So sorry to put that damper on, but you're doing a great job. I appreciate that, but I think you need more of everything to solve this problem. Thank you.
I'll speak to you.
Great, thank you through you. Um, Great observation, and totally agree. This is mental illness as an example is a huge concern in everyone's community. I think that my final comments in the slides was about how we need to work together, because it's a multifaceted. The solution has to be multifaceted. We have to have services that can provide support for people who are experiencing mental illness. We have need support for their families. But then we also need to think about how do we present this in the future and prevent this in the future. And that really is from a public health perspective, that's where we bring our skills and our expertise in. And things like our nurse family partnership. We're working on a project in Peterborough around substance use prevention in youth. Those are the things that we can really work on so that we can try to prevent mental illness in the future. We also have a role along with our community partners, municipalities, and social service agencies to advocate for change, for those policies that are going to help support people so that they have more money coming in than Sally does right now, so that they are not food insecure, so that they have stable housing. So it's as you said, it's a complicated problem. In public health, we call these wicked problems. It's a problem that needs everybody. Everybody has a role in it, and until we can come together and have a common vision and mission, and common strategies, it's going to be piecemeal. So that's how we need to move forward.
Thank you. And through you, Warden, I would love the opportunity to continue the dialogue, and perhaps can make some time to come up to Haliburton and have that, because I've heard of these issues and they're so significant across the country now, that issues that used to be felt more visibly in downtown Toronto are experienced in small communities across the province, across the country. And I think I do not have a silver bullet or a short magical answer, but I do have some key focal points that we really need to start collaborating and working on, because I think that nobody wants to see the suffering and challenges that we're seeing out there, but people are a little paralyzed with where we start and what we do and how we move forward. One of the fundamental things is housing. When 90% of Sally's income is going to housing, um, she doesn't have enough money to create a healthy, supportive environment for that kid. When that kid doesn't have that healthy, supportive environment, he's set on a pathway that's not fixed. We've all heard excellent, incredible stories of people overcoming adverse challenges, but the likelihood is much higher that he also is going to have challenges later. Housing. We need to sort out housing. 90% of somebody's income cannot go to housing. Either income supports need to be far more significant, or housing needs to be much more affordable. Housing should be a right that everyone has access to. Substance use challenges have become more complicated with the toxicity of the drugs on the street. The history of this challenge is one of, unfortunately, physicians in the medical establishment having had a role with pharmaceutical companies, really, trying to decrease the concerns with the toxicity of drugs back in the 90s, early 2000s. As there was more of a crackdown on prescribing drugs in the late 2000s, early 2010s, there was a push to the street supply, and as that happened as well, the street supply became far less predictable. Instead of heroin, which was sort of fairly predictable, we saw fentanyl, carfentanil, and these incredibly toxic drugs being concocted by dealers who are not chemists, and distribution on the street in an extremely dangerous way. In the last few years, we've actually seen a small decrease finally after decades of increase, and that is probably attributable to a few things. One is smoking instead of injecting drugs is actually a lot safer. It's a little less toxic in the way that it's metabolized through the system, but it also means that usually people are doing that outside and it's become more visible. So part of the response to the toxicity has been to try to be a little safer by smoking instead of injecting some of these drugs, but that's pushed people to the streets. A second piece is that the drugs have probably become a little bit less toxic than they were before. And sadly, the third component is a whole cohort of people have probably perished and probably died through use. And so we need to come up with solutions that treat mental health and addictions with the dignity and respect it needs. We had a movement towards deinstitutionalizing care in the 1960s, 70s, and 80s, which was certainly the right thing to do, but it didn't come with the resource investment that was needed to properly provide treatment to people in the communities. And there's still huge stigma against this as an issue. You think about heart disease, and people don't bat an eye at $20 million investment in a new interventional cardiology suite at the hospital. But that same investment isn't happening in the way it needs to for mental health and addiction. So housing, investments, and certainly coming together as a community to support people. I know people are tired. I know people are hurt when they see people in hurt, but we need to come together towards solutions. And I think they're possible. I certainly am a glass half full optimistic kind of person in light of these. But we do need to all work together to start to address them.
If I could just follow up on that briefly. I'm also the chair of Forecast, Four Counties Addiction Services team. And so when you talk about what are we going to do to improve this, homelessness, mental health, and addictions are all connected. The Forecast team has got funding for the Heart Hub. They've also just opened up a new detox and rehab center in Peterborough. So those are the missing pieces, as Dr. Piggott said, when they institutionalized this situation years ago. They didn't provide options for rehab, detox, as well as housing. So with Heart Hub funding, which is the homelessness, addictions, what's recovery and treatment is the acronym. Through the Heart Hub, once they come into the rehab and detox center, they'll be provided with housing. That's not where they came from, which is always the challenge. You go to rehab and you end up back in the same community that you've been, and you reoccur. So there are things happening. The province has committed a significant amount of money to Heart Hubs and the detox and rehab center in Peterborough, which is all brand new. So there are things happening that give us some hope. It's not a complete answer by any means, but providing proper housing is really the key to recovery for these folks.
Councillor Dale.
Thanks. I can only echo all of the thanks that's been shared. I won't repeat it, but it is in my heart. Very happy to hear Sally and Jeremy as being at the heart of what you do and how you conceptualize what you do. That's excellent. I'm a core believer in social determinants of health, and so to see the public health unit embrace that is just fabulous. I do have a question on that, though. I represent a community, as we all do to a lesser or greater degree, which is deeply rural. People are extremely far apart from each other. And one of the social determinants of health is community connections. And something that I've heard from many people over the last number of years is that the logical and understandable clamp down on, for example, things you can do in a basic community center, like bring in food from your home in order to share at a potluck. As those clamp downs happen, there is a direct impact on community connection. And the community center where on the lake where I live is slowly perishing, and not only because of this, not at all, I would never suggest that, but the fact that people can't get together and bring food in and share it amongst themselves when they play bridge probably means that they're not going to come into the community center for those purposes. I think another example would be, the standard of water provision for, childhood care centers, where maybe a small community can't meet the standard required. And that has a direct impact on our ability to care for those children in a healthy way. So question is there a conversation afoot on the relationship between community connection as a social determinant of health and and inspections? And where are you in that conversation? Because it strikes me that while yes, indeed, homelessness and substance abuse, those are major problems. They're largely outside of our control, but the social connection piece is largely within our control. So I'd love to hear where you're at with that at the unit.
Yeah, thank you so much, Counselor. Would love to continue the conversation on the particulars because I think you've brought up some great points. And I wholeheartedly agree that connection is so critical in our communities, especially small communities. And I've lived in very small and very remote communities before and know how important that is. I think the key at a food and water safety is people can die if we don't have vigilance to those things. We learned that through Walkerton. We learned that through kids on dialysis in Alberta who were served tainted food in their daycare, who unfortunately had not been inspected because funding and regulations were cut for inspections to ensure safe food. But there's got to be a balance in these things. And there's often some real solutions at some of the drinking water level. Usually what we're talking about is hundreds of dollars, maybe low thousands of dollars to solve some of these things. And I think we need to find creative ways to find solutions and really meet communities where they're at. Because I don't think the intention of any of the services that we do is to put a damper in that. It's just to put a floor and make sure that, you know, kids, people don't get sick, don't die from some of these preventable illnesses. And that can be done, I think, in a context-based conversation to really do that. And beyond that, I think to your point, what are the other factors that have driven this? We know there was more isolation through the COVID pandemic, and really trying to help people connect and reconnect, I think, is so critical. We know that there's been a trend towards more isolation and less connection over the last few decades or so. What are the drivers of that? And what are some bigger picture solutions that we can do to bring people back together? Because I think when you're looking out for your neighbor and you're looking out for each other, and you're not just worried about your family and maybe your immediate friends, but you care about the people in the community that you live in, we're all going to be a lot healthier as a result.
Councillor Ryle.
I think it's also safe to say that we're still in the development portion of where the health unit is going to be moving. I'm not using it as an excuse, but we certainly had some challenges in 2025 just becoming a unit. We started with 2 units and nobody was even sure this time last year that it was even going to work, much less anything else. And thanks to Dr. Piggott and staff, that has been basically put aside, completely resolved. There's also, there's some outstanding issues as we deal with them, but the biggest things that we're facing so that we could accomplish what we've been talking about here is getting communication networks that could work, and we would have one cohesive group of people dealing with it, so we could see what the actual challenges were that we were going to be dealing with. And at the same time, then set up internal operations so that departments were set up so we could focus on that. And it didn't end there. One of the things that when we were bringing this forward to all of our municipalities was we may or may not be able to do much about the cost, but we certainly can do a lot about the quality of service that's being delivered by a health unit. And that is the main focus of what we've been talking about. And if I'm not mistaken, in the first quarter of 2026, there's the intention to put together a strategic plan. I'm not talking about a book that sits on a wall and just occupies time and space. I'm talking about objectives that we want to accomplish through communication with the various municipalities that contribute and are part of the health unit. Now, that has not been done yet, but I know from conversations with Dr. Piggott and Mr. Black that that it is a high priority. It is something that needs to be done, and I am pretty sure that all of what we've talked about today is going to be addressed in some way, shape, or form. Now, bear in mind, I have a philosophy that I deal with. The impossible we handle right away. Miracles take a little longer. And I think that we're finishing off most of the impossible things that we thought we couldn't do, and now we can do. And now we're going to deal with the miracles. And the miracles are going to be accomplished. How many? I don't know. Over what period of time? I don't know. But they are going to start first of the year.
Councillor McKechnie.
Yeah, Doctor, there's 2 numbers here. Which would be the best number for me to call you? I'm going to call you. I don't want to can.
I'll make sure you have my cell phone.
We
but
could be
yeah,
here till after
yeah,
lunch.
that
if
sounds
I keep
great.
Talking about this issue.
I look forward to the discussion. I'll come visit you sometime. That'd be great.
Deputy Warden
Can I call
Danielson.
you? Can I call you?
Thank
Yeah,
you.
it's on my card there. I'll come circle the right one. Yeah.
Okay.
Go ahead, Liz.
Thank you. I must confess that when I first heard about this merger, I was somewhat skeptical. But I will say that as a result of all of your hard work and what I'm hearing today in your presentation, I feel much more hopeful that we'll see a lot more success going forward. So thanks very much.
Thank you. Other questions or comments? Resolution?
That the Lakeland's Public Health budget presentation be received for information.
Could have someone move? Councillor Dayu, second by Councillor McCackney. All in favor? It's carried. Thank you. Thank you. Council, I think we'll entertain a 10-minute break. Okay, thank you. Call the meeting back to order. Second delegation, Haliburton GIS strategy presentation, Holly Barkwell. Welcome, Holly, and Mike, and Aaron.
Please get me on screen.
Anybody else coming? Welcome.
Good morning. Can everyone hear me okay?
Yes, today, and your voice sounds better.
Fantastic. You all sound much better as well.
So, good morning, Warren. Before I pass it over to Ms. Barkwell, I'll just give a little bit of a background. Council may recall IT and GIS undertook an NG 911 readiness assessment with the BH Group earlier this year, and the results of that assessment was delivered in the fall. Through this engagement, the BH Group analyzed our GIS data, policies, and practices, and provided recommendations to help evolve our GIS service so that it can meet the strict requirements of public safety data in NG 911. I'm going to now pass this over to Ms. Barkwell and Mr. Croget, who will go into more detail about what NG 911 is, as well as talk about the recommendations from the report.
Thank you, Mike. Thank you all for giving us the opportunity to present to you today. There we go. Okay, so I'm here to present the findings of the NG 911 GIS strategy project. Sorry, I'm just trying to get this out of my way. I want to explain the importance of building a public safety grade GIS data set today. So my colleague Sean Crozier is also here to assist with questions or anything that I can answer. So first I'll spend just a moment introducing who we are. So first of all, BH Group works with public safety emergency communication centers, also called PSAPs or public safety answering points, also known as 911 centers, on technical and operational matters related to emergency communications. We also work with public safety agencies, municipalities, and governments on other matters related to emergency communications, like GIS, radio, 911 operations, governance, and policy related to public safety. So I'm Holly Barkwell. I am the president and CEO of BH Group, and I have 30 years or over 30 years of public safety communications experience. I have a number of credentials in the community, which I don't need to go over here today, but we work with agencies across Ontario, across Canada, the US, and globally on a lot of these types of projects. So we have worked on a lot of GIS projects in Ontario and across Canada, as has Sean. And a couple of those include York Region, Guelph, Kingston, the government of Yukon, and others. So I will now pass over to Sean and let him introduce himself briefly.
Good morning. My name is Sean Crozier. I'm the Vice President of Sales and Operation here at the Innovation Center. The Innovation Center is a not-for-profit located in Sault Ste. Marie, Ontario. Our focus is providing technological support for organizations across Canada, and we focus on GIS, IT, and data projects for the most part. And we try and solve problems for rural and remote clients. We see a trend where capacity issues in these smaller communities is prevalent. So we have a tremendous amount of experience managing GISs for organizations across Canada. We've been doing this since 2023, and we're very experienced in NG 911 and GIS and how to properly organize and set up GIS shops for clients.
Thanks, Sean. So I'd like to take a minute or two and explain to you the challenges we're facing with the existing 911 system and why we need the GIS data updated for public safety grade. Before the introduction of wireless technology, an emergency event was tied to a single phone at a single physical address, which was defined by the 911 provider, in this case, or in Haliburton's case, Bell Canada. If you look at at the slide, the column on the left, when somebody dialed 911, the phone number was used to look up a physical address in a table, and that address was used to determine which 911 center received the call. This setup made routing emergency calls very straightforward because the physical address also made responding straightforward because someone had to be near the scene or describe how to get there. In essence, they had to have the phone in their hand, which was literally tied to the service address to get there. Now, if we look at the present configuration in the middle column, which is where we are today, mobile devices were added to carrier networks in the mid-1990s, and things got a lot more complicated. Location became an issue for 911 centers, and not only that, users began moving around, and wireless carriers had to implement a number of complex algorithms to determine where the person was, using the closest cell tower location and then approximating the caller's location based on proximity to that tower. So there's a lot of complex math that went into determination, and it was not a perfect solution. It still isn't. Sometimes calls end up at the wrong PSAP, which causes delay in call answering because calls may have to be transferred around, and in emergency response times. We are now moving to next generation 911, which we call NG 911, which is the third column in the yellow box, which adds even more complexity. The ability to initiate emergency calls through social media, text, video, Internet of Things, and devices like Alexa and Google can now call 911. And recently, in the last month, Rogers just introduced the first satellite service. So the current enhanced 911 infrastructure, as it's called, just cannot manage these advancements. It was never designed to carry data. It was designed to carry voice. So we need to do something quickly. So the future of 911 and emergency response is rolling out across the country today. The transition to NG was mandated for PSAPs by the CRTC in 2017, and every telecommunications company in Canada must comply with the directive, which states every 911 center and emergency dispatch center in Canada must transition to next generation 911 technology, which is to transition to an IP-based infrastructure. And this PSAPs are not regulated by the Commission, but they are compelled to do so because the Commission mandated that the telecommunications carriers must decommission the existing architecture as of March 31st, 2027, pardon me. So as part of this process, under the Commission's direction, Bell Canada had every 911 local governing authority sign a new NG 911 service agreement, which contained a list of responsibilities. One of those responsibilities includes GIS data used for public safety, for call routing and emergency response, making the creation and management of GIS data for public safety a direct county responsibility. While emergency dispatch is not a direct concern for the county, the quality, accuracy, and currency of the GIS data used for dispatch is a county responsibility. So the transition to next generation 911 brings a lot of change, all of which is necessary and positive, including the way calls are routed to 911 centers and how the information is received and processed by the agencies that dispatch emergency response. As I mentioned, the emergency call routing process, which is the core of the existing 911 system, will transition from the table-based system I mentioned a moment ago, which relies on physical address or proximity to a physical address, will transition to a GIS-centric system using XY coordinates or latitude, longitude, and eventually Z, which is an elevation coordinate. This will become important in high-rise buildings and underground parking complexes. The new routing process for calls is called geospatial routing, and it will be introduced sometime between 2027 and 2029, which is why it is critical to begin organizing GIS data and building compliance with the NG 911 GIS data standards immediately. When the rollout is complete across Canada, we will be the first country in the world to achieve a fully IP-enabled geospatial-based 911 end-to-end system. But there's a lot of work to do. Whoops, there's a lot of work to do to get ready. All right, I went too far. Back up for a moment. There is a lot of work to do yet. So as you can see in this slide, we have information coming from a number of new sources that we haven't had to deal with in the past. So we have to do things differently. So the first step in getting ready was the GIS Lifecycle Strategy Project. And our team met with county and municipal representatives, and we discussed how GIS data moves through the system today. We made a ton of notes and collected data from the county and from local municipalities that participated in the process. Then our data techs, or Sean's resources, used several GIS tools to assess the data that we received, and we developed a report detailing what we found. The report, which outlined some activities, which we'll go through in a second, and how we're going to move forward. So we delivered a report that detailed the current state of GIS readiness for NG 911, the gaps that we found in the processes. We made several recommendations with strategies to address how to fix the gaps or close the gaps with estimates on effort, resources, training, and solutions. And we also provided a roadmap with timelines. The study focused on existing GIS data provided on or by provided by or on behalf of county project participants, which included Algonquin Highlands, County of Haliburton, Dysart et al., Highlands East, and Minden Hills. And that's the information that's used for public safety purposes. The intent is to move forward toward a public safety grade GIS data set with content similar to that outlined in the National Emergency Number Association, or NENA GIS standard, which is mandated by the Commission for use in the NG 911 environment. So the standard that's used to build the NG 911 environment envisions in the future a 72-hour turnaround for data updates, which is the time it takes for data to be created by the county, delivered up to what we call an aggregator, who is going to collect the data to be put into the 911 system, which is Bell Canada, and then delivered back down to PSAPs. And that's a time from when a change is made. That 72-hour goal is absolutely impossible today across Canada, because most of the systems that are used are manual, with a lot of manual data entry, which requires either manual processing or memos, notes, and different methods of getting that data where it needs to be. So in order to reach that goal, we need to make sure that the data is compliant with the standards that are proposed, and we need to make sure that as many processes as possible are automated and the workflows are as efficient as possible in order to meet those standards. So some significant work is required. In our project, we went through several activities. We gathered information, we analyzed it, we drafted a report, and then we delivered the final report. So we held a workshop with participation from the identified departments that I just mentioned. We conducted some follow-up interviews, questions and answers with county representatives. We consulted the NENA standards that I just mentioned and best practice and industry best practices, and we reviewed national work that's currently underway on the transition to geospatial routing, and we documented our findings. We reviewed the existing workflows and data practices to assess the coverage gaps, missing information, and dependencies. We compared county and municipal data to the NENA GIS we conducted a layer by layer comparison of the GIS data. So we reviewed it for descriptive attribute content, data integrity, data management and use. And then we reviewed how the county data owners and custodians and consumers worked with the data needed by NG 911. So we mapped out those workflows to show what they look like today, and then made some recommendations on how they should be modified and improved to work in the new environment. So based on the report that we delivered, we made 7 recommendations, which included data correction and cleanup, more clearly defined workflows and improved workflows, recommendations on data management and how that can be improved. And the issue of custodianship and data governance needs to be addressed. County and municipal communication plan should be developed. Quality assurance is a big issue in this new environment. So a plan needs to be developed and implemented, and some public education and materials based on what we saw. So what you see in this list are high-level recommendations. The report contains the details for all of these tasks within each recommendation that should be completed and in what sequence. The work is substantial, and we estimate it will take approximately 724 hours to complete. And the NG 911 GIS environment will require substantial investment in time and effort. It needs to be built and it needs to be maintained. And it's critical that the work begin immediately to meet the deadline for the introduction of geospatial routing. So, the workflows, processes, data management, and governance are key to the long-term sustainability, contributing directly to citizen and emergency responder outcomes and safety. The one point I would like to leave you with is to please keep in mind that this is not a one and done project. The data that we're proposing is to build the 911 and public safety emergency response data set. We need to build it to public safety standards, and it's crucial to keep the data maintained and up to date on an ongoing basis because lives literally depend on it. And that is it. Thank you very much for your time. And if there are any questions, please go ahead.
Mike, did you have anything you want to add?
I don't think so at this point. I do have a report later on the agenda, but I can speak a little bit about next steps. But I think Ms. Barkwell and Mr. Crozier did a good job, excellent job explaining the what NG 911 is and the importance of meeting the requirements.
Questions? Councillor Dave.
Not a question, actually, just a comment, just to say thanks very much to Mike and to you, Holly, and your team for this. The presentation just shows that we're now catapulting ourselves into this century, and that's really, really important. I think especially for a county like Haliburton, where we have a ton of water access only properties, and we have a ton of tourists and people who don't actually know where they are when they have an emergency and can't refer to a crossroads. And I can't say with any degree of authority whether this is a truism for urban areas as well, but certainly in our rural area, if we can adapt how communication flows to 911 services so that location can be more readily recognized, then we're doing everyone a favor. And so I'm so grateful for all the work that's being put into this.
Councillor Ra?
Yeah, excellent presentation. I just have one outstanding question. Using the ice storm as an example, one of the things that we ran into was the lack of communication either through landlines on phones or through cell towers because they went out of commission. And it's all well and fine if you just want to talk to your sister or your brother, but when you're really trying to report something and get it organized, in the new plan, is there an opportunity or will there be a consideration for cellular communication at that level so that we can deal with it? I know you mentioned Bell or Rogers satellite capability. Is that something that's going to be included?
In the roadmap that you have currently mapped out today, no. We're just focusing on GIS data specifically. There are new technologies being rolled out. For example, Rogers just initiated a new service that's text via satellite. So low Earth orbit satellites are becoming more common. So Bell will be introducing a similar service in the next year or so. So that will make redundancy better. So in the event that you can't reach, if a tower is down, an Earth-based tower, then you will be able to do at minimum text by satellite and some other methods as well. There's still Wi-Fi, so many devices can make calls using Wi-Fi technologies as well. So that's a different discussion and an excellent question.
Thank you.
Gary?
Yeah,
Sorry,
thank you.
Michael.
I was just going to add to echo Ms. Barkwell's point. You know, the this engagement was just strictly on the compatibility of the current GIS data and processes to meet NG91 criteria. But I know through the budget process we have some recommendations on how to add in some additional redundancy to our communications plan that was lacking. What we found was lacking through the ice storm. It doesn't cover every eventuality, but it does strengthen it better than we have today.
Good.
Thank you, Warden. Just to add to Mike's comments, while a different subject matter, we have been trying to work with Bell with respect to the redundancy issues and the issues we had during the ice storm. And I regret to say those efforts have been futile. Very disappointed in Bell's response to our request to meet on certain issues regarding redundancy. However, we have been working with EORN and we have been had discussions with Rogers looking at, so we are doing our best to attempt. It's unfortunate that Bell's not coming to the table to help us in these efforts, despite the outreaches from the mayor of Minden Hills, Councillor Carter, as well as the Premier's office. But we're continuing to try, and we'll be bringing a report back to Council with respect to the problems we're having with Bell to Council at a later date.
Other questions? Resolution?
That the Haliburton GIS strategy presentation be received for information.
Could someone move? Councillor Shell, second by Councillor Ryle. All in favor? It's carried. Thank you.
Thank you.
Thank you. Consent agenda?
The items listed under the heading consent agenda for November 12th, 2025 be adopted as presented.
Could have someone move? Councillor Shell, second by Councillor McCackney. All in favor? It's carried. Consideration of reports, public works, transportation. So.
Morning, Warden and members of council. This report is staff are requesting council endorsement for winter maintenance services with the 4 local municipalities. Each year, the county enters into agreements with the local municipalities for winter maintenance services. The agreement scope of work covers patrol, plowing, and material application. The operational rates are adjusted to reflect the actual cost of the local municipalities providing the service. And I'll take any questions.
Any questions? Just Councillor Dave.
Thanks, Sil. This came up at our Algonquin Highlands Council just a few weeks ago, and I recall Murray actually raised it last year as well. Do we know that each of the 4 municipalities use precisely the same line item criteria when determining the cost for, or for what they're charging for these services? Or is everyone working on sort of a different set of variables?
Well, no, it's all on the same. They should all be using the same criterias for evaluating their costs associated for providing the service. I know there's a difference in costs that my assumption is that it reflects the actual cost of the municipal services.
Other questions? Resolution? Oh, sorry. Liz? Thank you. Muted now, Liz.
Just a comment on my agenda, Algonquin Highlands Agreement shows up twice and I don't see Minden Hills Agreement.
I can see Minden Hills on the left column under the transportation line, Liz, but I don't see it on the report that pops up. But you can see it on the left side.
Okay.
Resolution?
That staff report PWS 19/2025 be approved, and further that the bylaw authorizing the warden clerk to execute the identified winter agreements be authorized.
Can I have someone move? Councillor Ferry, second by Councillor Ryle. All in favor? It's carried.
Thank you.
Thanks, so. Planning Department, work plan update, Elizabeth?
Thank you, Warden. There are a few items to note from the report. Since publishing the agenda, some of the timelines noted in the report have changed. Because of the jam-packed council agendas until the end of the year, ULinks will be coming to council's January 14th meeting to give a presentation on the results of the last 2 years of the water quality program. And it's also noted in the staff report that the strategic plans, what we heard, report would be coming today. However, it will be coming also early in the new year. With respect to the county's Land Division Committee, the updated stats are included in the report, and the number of applications to date is still trending similar to previous years. The shoreline bylaw matters are winding down due to the winter season upon us, with no complaints received since September, which I think might be a good thing, hopefully. And we've just had a couple permits, but otherwise it is slowing down, which is seasonally usually the case, as we've experienced. Moving forward, we'll be working on a few policy matters, including the initial materials to pursue a housekeeping and PPS conformity official plan amendment. So what that would entail is some draft policy revisions being brought to council for consideration, and if council doesn't mind them, I guess, you would direct us to proceed with processing of an OPA and holding the public meeting and whatnot. So we're working on that and should be bringing some preliminary materials to council for consideration soon. And with that, I'm happy to answer any questions.
Thanks, Elizabeth. Questions? Resolution?
That staff report PLN 2025 Planning Department work plan update, we received information.
If someone move, Councillor McKechnie, second by Councillor Ryle. All in favor? Carried. The new County of Haliburton LiDAR floodplain mapping, Elizabeth.
Thank you, Warden. Just give it a minute to bring up the presentation. Okay. County staff have been working closely with our partners at the Ganaraska Region Conservation Authority for quite some time now to produce a high-quality, accurate floodplain mapping product for use here in the county. Most of the original floodplain mapping in Ontario was completed in the 80s and 90s when technology was limited and our climate was more stable. Since then, weather patterns have changed, and the county has seen more frequent and intense rainfall, higher spring melt flows, and stronger storm events that can cause flooding in areas not shown on older maps. Because of these changes, the older mapping no longer reflects current conditions or future risks. Existing floodplain mapping was created using air photos and ground surveys, and LiDAR is a much more advanced technology that uses laser pulses from an aircraft to measure the land surface with very high accuracy. It can even quote unquote see through tree cover to create a detailed picture of the ground, which lends itself to creating a more accurate mapping product. While LiDAR can be used for a variety of purposes, in this case, it was a key component to producing higher resolution floodplain mapping for portions of the county. Looking at policies that relate to floodplain management, the most prominent piece of legislation directing such is the Provincial Planning Statement, or the PPS. PPS sets out how land in Ontario should be used and developed, and one of its main goals is to keep people and properties safe from natural hazards such as flooding, erosion, and unstable slopes. PPS requires municipalities to direct development away from areas that could be affected by flooding, unless it can be clearly shown that the land can be made safe. This means local and upper tier governments must identify flood hazard areas using the best available data, such as up-to-date LiDAR mapping or other new floodplain studies. The PBS also delineates two different floodplain management approaches. The first approach applies to small inland lakes, such as those found across the county. They are evaluated on a one-zone floodplain basis, wherein the regulatory flood elevation for these water bodies is a single static elevation. And the PPS says that development is not to occur below that elevation. The other approach is with respect to riverine systems, wherein floodplain areas are managed using a two-zone concept. In these situations, the floodplain is divided into two parts, the floodway and the flood fringe. The floodway is the deepest and fastest moving part of the floodplain. It is the area that carries most of the floodwater during a major storm or spring melt. And because it poses the greatest risk to life and property, no site alteration or development is allowed in the floodway, according to the PPS. The flood fringe is the outer area of the floodplain where water is shallower and moves more slowly during a flood. In some municipalities, limited development may be permitted in the flood fringe if floodproofing and safety measures are used. For example, raising the building above the flood level or protecting utilities and access routes. Together, the floodway and flood fringe make up the regulatory floodplain for river systems, which is typically based on the 100-year storm or regional flood event, whichever is greater. And the PBS directs municipalities to use these zones to manage flood risk and guide safe development. A third component that the PBS controls with respect to floodplains are areas that would be inaccessible during a flood event. Specifically, the PBS provides restrictions for development and site alteration when safe access or egress would be impacted from an area in a flood event, even if the lands themselves would not flood. And areas that would leave individuals stranded during a flood event are to be included in floodplain mapping according to the PPS. And I'll touch more on that later. So with respect to creation of floodplain mapping itself, how to do so is heavily prescribed by the province. However, this area does have a bit of a unique component involved with respect to lake elevations in particular, given the influence of the Trent Severn waterway. As users of the new LiDAR mapping will see, a new addition to the county's comprehensive floodplain mapping product is the availability of the flood elevation data for many lakes across the county that didn't exist in the existing mapping. This mapping was produced using the high water levels recorded by Parks Canada and then cross-referenced with LiDAR elevation data and Parks Canada water level gauges when available. In cases where this cross-referencing data wasn't available, GPS readings were collected on site to gather elevations of dams and other structures to be able to create this mapping. It should be highlighted that these flood elevations are based on previously recorded water level values, not through any engineered hydraulic models that other data is created from. So the flood elevations on the one zone mapping have happened before. With respect to two-zone models for rivers, how flood elevations are calculated is very black and white and directed by the MNR's Flooding Hazard Limit Technical Guide. It's called a guide, but it's not just it doesn't guide, it directs. So the technical guide requires that the overall limit of the floodplain is created by feeding in contextual data of a river system to an engineering hydraulic model and then testing it against two different storm scenarios. The one in a 100-year flood event, and then the design storm for an area. In the case of Haliburton, the design storm is a Timmins storm, and south of us, it would be Hurricane Hazel. Processing all this data through the hydraulic model will produce two different elevations as you move along a river system, and the province requires the worst case scenario of the two to be used as applicable. So through a river system, it could oscillate between the 1 in 100-year storm and the design storm if in certain areas one ends up with a higher elevation during a flood than the other. The technical guide then provides only one acceptable calculation to figure out what lands within the floodplain along a river would be considered the floodway. This is done by multiplying the depth of the water by the velocity of flows, and any areas that exceed 0.37 meters squared per second would be considered floodway. The tricky part of mapping the floodway is that it doesn't result in a static elevation, as different configurations of these two values can result in floodway classification. And I'll touch on how to address this later in the presentation. Something that's important to note is that there will be differences between the existing mapping and the new LiDAR product. This can be attributed to multiple things, one of which is that the ground data is much more detailed now than it was back then, which better refines the extent of the floodplain. How to calculate the floodway has also changed. As you can see in the chart on the slide, the 80s method was just that if depths were over 1 meter, those lands were deemed to be floodway. On the right, you can see that there are numerous factors involved, and that calculation comes into play under current standards. So this will inevitably change what lands are captured. So since receiving all the floodplain data from GRCA, County GIS staff have worked very, very hard to produce a user-friendly interface for everyone's use. This not only includes the mapping itself, but also additional information about the project and how to use the information on the map. This includes a handy how-to video that walks you through the mapping interface, which we thought we'd try to play for council now, so you can see what the public sees going on this map. Hopefully it works. And that's the end of the video. Very riveting. I hope you enjoyed it. So not everyone, I guess, when it comes to the video, we thought it would be beneficial because not everyone uses web mapping every day, but we wanted to create a product that everyone could use. And to ensure that people can use it independently, don't have to rely on contacting staff to be able to figure out things that are quite easily accessible, providing the video and a written how-to guide, we think will help greatly with people self-navigating the product. So building on the video, there may be a question of how will people use this mapping to figure out where the floodplain exists on their property. For lakes, the static elevation can be easily plotted out by a surveyor using the elevation indicated on the mapping in any plans and drawings being completed for a property. Staff anticipate that this would only be required if development was proposed in close proximity to the boundary of the floodplain on a lake from property, and it would be difficult to confirm whether development is being proposed in the floodplain or out of the floodplain. We don't anticipate that it would need to be used all the time. For two zone or river properties, it's a bit more of a complicated process. 7 steps, which are described on the slide, and I'll just go through them quickly. So you would open the mapping interface and locate your property. You'd then click on your property and access the link to the relevant index map in the pop-up as shown in the how-to video. When looking at the index map, you'll see a cross-section on either side of your property, and that will look like the image on the slide with the circle, the white circle with 2 elevations in it. And they're peppered all over the index maps for people to use. In the bubble, there's 2 elevations. One is the 1 in a 100-year storm event, and one is the Timmins design storm. And the resulting elevation from the hydraulic model where how high water would go in a flood event in each scenario. So you would take all 4, so both on either side of your property, and figure out which one's the highest. That would be then plotted on your plan, and that is the floodplain limit. Then, going back to the discussion of how to calculate floodway and that there isn't one elevation point, you would then overlay the floodway layer, GIS layer, accessed from the county's open data repository, overlay that on your property, and now you would have a finished product showing your floodway and flood fringe. And then with respect to development, there's different permissions or restrictions associated with each area, but you would have a highly accurate depiction of the floodplain. This process, it's a bit process heavy. However, it is similar to other municipalities that have implemented LiDAR across the province, and it is by far the most accurate depiction of a floodplain on a property for use in development scenarios. Moving forward, there's some additional work to do. In the long term, the floodplain mapping should be incorporated into the county's official plan, as well as the local municipal official plans and zoning bylaws to ensure consistent application. In the short term, should County Council endorse the mapping, this endorsement allows for the new mapping to be factored into reviews of development applications. However, there will be a gap in application with respect to building permits, as until it's enshrined in zoning, it would not be considered applicable law. Accordingly, staff have been and will be collaborating more with local municipal staff to move through the process of incorporating the mapping into planning policy documents to ensure this gap is resolved. And as noted throughout the presentation, the PBS has a relatively new provision with respect to safe access or egress. County and municipal planning staff have been in ongoing discussions about how to address this in a way that achieves PPS conformity while also avoiding undue hardship to property owners, as applying the same limitations may not necessarily be the best approach. And as you may have seen on the map, the purple areas that are just the access limitation areas in accordance with PPS policy do identify a lot of properties that would not flood themselves, but people on those properties would be stranded in a flood event. Emergency services would not be able to get in, and the residents would not be able to get out. So given the identified need for a balanced approach to those areas, staff will continue these discussions and bring forward proposed official plan policies to address this component of the mapping for council's consideration in short order. So with that, staff recommend that council endorse the new floodplain mapping as attached to the staff report. And I'd be happy to answer any questions you might have. Thank you.
Thanks, Elizabeth. Questions? Councillor Carter.
Thank you for this. This has been a long time coming, from the time when the airplanes were flying low over the various rivers. Do we have, I know virtually every property is affected in some way, shape, or form, but do we have a count on how many actual dwellings have been affected? In other words, they were not in floodplain or not in the area being stranded, and now they are. And then the second part of the question is, if there are people like that, what practically does that mean to them vis-a-vis insurance or renovations or whatever?
Through you, Warden. We don't have an exact number, but we can absolutely look into that, just cross-referencing our photos with with parcel fabric, if that's something that you would like. What we notice is that at the access egress provision aside, some properties actually had land free up and become developable through this process. Some did become more encumbered. We can put together some comparisons of before and after sort of thing. I think from a real life perspective, even though some properties may be newly identified as being within the floodplain, that's not because of this mapping, they would now flood. They were going to flood, just not know they were going to flood in a flood event. For properties that safe access provision, I'm not entirely sure when it comes to matters such as insurance or whatnot, but because it's not in a floodplain, I'm not sure that there would be any impacts of that nature to those properties. And as I mentioned in the presentation, we're looking at policies that would still provide fairness to those property owners. Perhaps it's not the expansion of habitable space, but that doesn't preclude you from being able to build a garage or a shed, something that is a structure but doesn't increase the ability for people to inhabit and become compromised in those times of flood. But that's still very much so in its infancy of what would meet provincial policy while also not unduly negatively impact property owners. So it is a bit of a tricky spot to be in. This provision in the PPS is much newer than what the existing floodplain mapping had and what the PPS at the time said. So it is something new to navigate. And we'll definitely be seeking some best practices information from other areas of the province that have implemented new mapping and have to also incorporate that provision into their policies and what they've done to address it.
Bob, go ahead.
No, just to council, this could have some very practical impact on an awful lot of our citizens, and we may need to figure out what is it that we can do to mitigate this. And I don't know what that possibly could be, but all it takes is a few centimeters for that zone to, if the land is flat, for that zone to increase pretty drastically in area. So and as you said, using these different if you will, metrics to measure it, it could have a big impact. And I would hate to see, I mean, for us, it would be you know, Minden in particular, being an area that could flood, there could be an awful lot of people who are not necessarily as affluent as the folks around the lakes who are going to be the most affected by this. So we may have this process is not going to be something we can just snap our fingers and overnight it'll be done.
Thank you. Councillor Dayu?
Yeah, I was thinking along the same lines that I'm looking forward to getting through that transition phase of when people purchased properties believing they could do a thing, and now, and you know, in the planning world, you've come across this all the time, but you know, we're entering a new one. So they've purchased something believing fully that they could do something, and now there is information that not only indicates that it's not a good idea, which, as you say, was there all the time, but that they may not be permitted to do it. And that's going to be a little bit complicated. But could you just clarify for me, has every water body and water channel in the county been mapped in this way?
Through you, Warden. Not every lake has updated elevations. If it is, if the lakes are connected in some way, it appears that those elevations are present. If they're sort of isolated stranded lakes that aren't in the direct watershed, those because that data was never collected historically for those lakes, those updated elevations could not be provided. But the Gull and Burnt in their entirety have been updated.
Questions? Resolution?
Staff report PLN 19/2025 be received, and further that County Council endorses the new LiDAR floodplain mapping for use in land use development proposals and emergency preparedness as attached in appendices A, B, and C to staff report PLN 19/2025.
Can I have someone move? Councillor Carter, second by Councillor Shell. All in favor? Carried. Thank you. Thanks, Elizabeth. Economic development, physician recruitment. Wendy, how are you?
Good morning, Warden and members of County Council. I bring before you today a staff report regarding a physician incentive agreement for Dr. Max Ranney. So Dr. Ranney is a family physician, and he contacted staff in response to our physician recruitment website and also a job posting on Health Force Ontario. He came from Maine in July and came for a community visit and tour of our facilities. So Dr. Ranney has made a commitment to Haliburton Highlands Health Services for full-time practice starting in April. He'll be supporting and serving the Haliburton County residents by caring for patients, acute admitted patients in the hospital, as well as working in our emergency department. And this arrangement represents full-time practice. Dr. Falconer, who's the new chief of staff at HHS, has also informed staff that HHS will no longer need to recruit for this hospitalist role, and also may not need to recruit any further for the emergency department. It kind of remains to be seen. But this, once Dr. Ranney starts, this would fill that roster. And staff has also included in the report statement about how HHS provides support to physician recruitment. So I would welcome your comments or questions at this time.
Thanks, Wendy. Questions? Comments? Councillor Rao.
Wendy, just recently now we've been talking about the situation in Quebec.
Mhm.
Okay. And it appears there could be an exodus of physicians from there. Is there anything at this point, I know it's only recent, so you may not have a whole lot of information. Is there any opportunity there for Haliburton County to reap the benefit of a bad situation?
Definitely. So Haliburton County is part of an alliance called Eastern Ontario Physician Recruitment Alliance, and we are under the umbrella of the Ontario Physician Recruitment Alliance. So they have umbrellas for our different regions like Central Ontario, Northern Ontario, etc. So there was a big protest in Montreal on Sunday where thousands of physicians gathered in Montreal. And our umbrella alliance, the Ontario Physician Recruitment Alliance, launched a campaign that day. So they did have a presence in Montreal. They rented a large mobile sign. It was actually on the side of a truck. It was on all sides of the truck, and they parked it right where the march was happening. So, and we've also launched social media campaign since it was actually launched on the weekend. So we're doing what we can there, and we're actually received 12,000 hits on the Oprah website that day on Sunday. So, and I've personally had 3 leads this week from physicians from Quebec. So the leads that go to the Oprah site, Ontario Physician Recruitment Alliance, those all get filtered through a database that has all of the physician job openings across the province for all of us that are in this alliance. So our job postings are on there. So.
Thank you.
Other questions? Resolution?
Staff report EDT 14/2025 Physician Incentive Agreement. Dr. Max Rainey be received, and further that Haliburton County Council authorized the warden and clerk to enter into a medical services agreement with Dr. Rainey for a period of 4 years with 4 $25,000 incentive payments scheduled for 26, 27, 28, and 2029.
Can I have someone move? Councillor McKechnie, second by Councillor Ryle. All in favor? It's carried. Thank you.
Thank you.
Thanks, Wendy. Economic Development Division status update. Scott.
Good morning, Warden and members of council. Just before you today is our economic development status update. There are a few items I would like to note in particular. Just starting with the We Care project. So we did receive the findings from Greer Galloway, who's conducting the phase 2 ESA on that site. And the results from that study came back positive, and I say positive in the sense that it would not impact future development and or human activity to move forward. So that's great news for us. I do know we've run into some technicalities around the land survey on the site, and I've detailed them. If there's further questions, I most likely will direct those to our Director of Planning, who probably answer them more eloquently than I could. So because the findings in the study don't require us to register with the Land Registry Office just on the previous activity, we will bring those findings forward to you with the survey, and we do indicate that we would recommend moving forward with our project partners. But in light of time and in conversations with our CAO, we are going to reach out to our project partners and just kind of get that process started now, so we're not waiting into the new year. Just recognizing that we have a couple large agendas coming up just related with budget matters. The second item is just the transit RFP has been issued, and it was originally supposed to close on November 14th. We did receive several inquiries just to extend the deadline. So in conversation with our procurement staff, we have extended that deadline to November 28th. And then we'll have a consensus meeting early in December. And then just depending on meeting schedules and agenda size, we'll either try to get in front of you either the first meeting of January or the second meeting in January. We do identify that we did have our second short-term rental appeals committee on November 3rd. We did receive 5 appeals were heard, and we have tentatively scheduled the next meeting for December 1st. Moving forward, we will schedule a monthly meeting with the committee, and then we can either cancel that or we can cancel that meeting if needed, if we don't have any appeals. And we'll continue to work and streamline that process. I will admit that we did get the agenda out a little late on our second meeting, and it did require the committee members to do a lot of reading over the weekend. We also are just finalizing the incorporation for the Municipal Services Corporation that will handle the county's portion of the municipal accommodation tax revenue. A previous report identified that we'd have the 4 mayors as the 4 initial board members. We'll have an initial meeting with that group. A couple items just to note that Municipal Services Corporation operates just slightly different in the sense that our agendas don't need to be posted publicly on our civic web. We will follow through with that process just in respect to transparency, but we're not subject to our similar procedural bylaws. So a board meeting is slightly a little bit more informal. At that initial meeting, there'll just be some paperwork that needs to be signed, just appointing board members and things like that. We will have a discussion and a review of the transfer payment agreement. That is a legal requirement from the province. Get the endorsement of the group there, and then those subsequently will be presented to the township municipalities for ratification and or additional input just on the contents of those documents. And then lastly, on that meeting, we will just have a discussion around the process that the group would like to identify to go about recruiting and or appointing the 3 public members of that board. And then lastly, just included a note just in light of some recent media coverage just around municipal bonusing related to our investment attraction plan. Just did note that the one clause in there is it states an obviously undue advantage. I did communicate with council, I think, after that article, but we would treat every prospective investment opportunity equally and wouldn't provide that undue advantage to anybody else or any specific business, which as was alluded to in the article. So with that, happy to field any questions on what I presented to you or additional content within the staff report.
Thanks, Scott. Questions? Councilor Ryle.
Scott, when will the corporation actually exist and become an entity?
Just ran into a couple things when we were registering board members. Just I put as an example Dave Burton down for the ward, and it's actually David. So I believe in conversations with the lawyer, it'll be incorporated by the end of this week. And then it's literally just a matter of appointing the officers at that initial meeting. As I said, it provides the structure of the meetings provides a little bit more flexibility to get that group together and meet fairly nimbly. So by the end of the week, it would be incorporated. We'd have that initial meeting, and then probably by the end of the year, have the TPA finalized. And we've been withholding receiving payment from the townships just until the TPA is signed, because that one component of that agreement would outline when that remittance takes place.
We'd be ready to go first of the year.
Through you, Warden, absolutely. There's still, given it's a new program, as we noted when we were first presenting this, there probably won't be a lot of money there. Initially probably 2026 would just be used to do some planning with the group, outlining priorities, and then hopefully by June there could be we have the ability to potentially make some revenue projections, and then we'd go about the process of building out what that operational plan and business plan would look like to be presented to county council next year for approval and ratification.
Other questions? Councillor Dale?
So a question perhaps more for the CAO clerk. There's presumably no concern about quorum of council as the 4 members, as the 4 mayors sit on the board?
No, from a procedural standpoint, there wouldn't be, simply because it's an advertised meeting. It's identified as a meeting, so it would be, and the purpose of the meeting is identified, so it wouldn't be.
Other questions?
And they're all not from the same council, correct? They're right. Yeah. Thanks.
Resolution?
That staff report EDT 14/2025 Economic Development Division Services, status update, November 25, be reviewed, received as information.
Can I have someone move? Councillor Dayo, second by Councillor Shell. All in favor? It's carried. Thank you. Thanks, Scott. External awards. We're down to business arising from our previous meeting. NG 911 final report. Mike?
Yes. Yeah, so this would be the report following the presentations this morning, Ward.
Hello again. So I put this report forward to council to give a little bit of context to the engagement and to talk a little bit about what the next steps are from IT. I won't delve too much into the findings or what NG 911 is unless council wants. I think Ms. Barkwell did an excellent job covering those things, but again, I'm happy to answer any questions on that. In terms of next steps, just to maybe talk about a few things that IT and GIS have been working on and will be continuing to work on. We started the process to look at applicable workflows within the county departments to identify where possible, where we could integrate the 911 civic addressing workflow. That's a key point for NG 911. We need to be able to collect address point data through the through the 911 civic addressing process. So we want to make sure that that is integrated wherever it makes sense to integrate it. We will begin enhancing our quality assurance and quality control processes so that they align more with a public safety grade requirement. Continuing work on a data tracking and reporting system for data remediation tasks. So as we start remediating data, we can track that and report on it as required. We've planned and hope to roll out a ground truthing program in 2026, ensure we have address point data for all applicable properties within the county. I shouldn't say we, at some point when the original 911 program was completed, there was address points taken as a part of that. However, a decision was made, and I don't have the background on that decision, to not continue to collect address points. So through the consultant's recommendations, we need to basically try to regenerate those address points where we can and collect the ones where we don't have it, because the address points are exactly how dispatch routes calls. So if you don't have a address point on your property, it's possible, the dispatch could be, the first responders could be a little longer getting to your home. We're going to investigate the possibility of addressing vacant land, not something that's not currently done today, 911 civic addressing of vacant land. Obtaining or creating data sets that we currently don't have today, such as OPP coverage areas, things we didn't need up until this point, but we do need going forward. And continuing the process of data remediation as per the NG 911 report. I think that's in a very high level. I do plan on we have a core project team reporting back up to our senior management team and then reporting back up through council on the progress on this, because I know it's a very important project, and I'm sure council is eager to understand how it's rolling out. As always, happy to answer any questions.
Questions? Comments? Resolution.
Staff report ITS 11 2025 NG 911 final report summary of findings be received as information.
Could have someone move? Councillor Dayu, second by Councillor Fury. All in favor? It's carried. Thank you.
Thank you.
Thanks, Mike. Gary, I think I'll tuck your request in here right now.
Thank you, Warden. And I apologize for not having this on the agenda, Councillor. I'm just looking for requests, any requests Council may have regarding delegations to the upcoming Roma conference in January. I've had a brief conversation with Councillor Dayu, and she's recommending that we request a delegation regarding the lack of appropriate library funding going forward. So I have that in the list, and any other suggestions, recommendations, Council will take that time. Now, sorry. Thank you.
So do you want it by next meeting?
If I could have it in the next day or so, just get the requests in. I think the deadline is the 18th of November, and we can get the requests in based on that. We've looking for new requests versus ones we repeated, and I will have a more fulsome report regarding a larger delegation we'll be looking at for the AMO conference, but not for the Roma conference.
Okay, Cease?
I certainly would strongly support putting some kind of a delegation through for the library funding, because that's way out of whack.
Okay, great. So let Gary know if there's anything. What will you do then, Gary? Will you come back to county with it?
No, the process would be is I'll take it as direction from council. I'll start the one tomorrow with respect to the library funding. We'll submit the applications and report back to council on our success or lack thereof as we move forward. And then if we are successful, then we'll have the similar to Roma Annie and AMO meetings. The delegation package will be produced and provided to council for information. And we do share those with the local municipalities as well.
Thank you. All right. Bylaws.
The following bylaw being acted and passed, bylaw 4323 being a bylaw to authorize the execution of agreements for winter maintenance services with the townships of Algonquin Highlands, Municipality of Dysart et al., Municipality of Highlands East, and the Township of Minden Hills.
Could have someone move? Councillor Dayu, second by Councillor McKechnie. All in favor? It's carried. No closed session. Confirmation bylaw.
That bylaw 4324 being a bylaw to confirm the proceedings of the November 12th, 2025 meeting, Haliburton County Council be considered to be read a first, second, and third time.
Could have someone move? Councillor Dayu, second by Councillor Shaw. All in favor? It's carried. Adjournment.
That the November 12th, 2025 meeting at Haliburton County Council will be adjourned at 11:12 a.m.
Moved by Councillor McKechnie, second by Councillor Ryle. All in favor? It's carried. Thank you. Thank you, council. Thank you, staff.